Hello everyone, my name is Riley Anderson, and in this video we will take a closer look at the pharmacokinetics of veterinary medicine, specifically calculus's role in determining the presence of drugs in an animal system. One of the most important concepts in veterinary medicine is drug absorption and elimination in animals' bodies, better known as pharmacokinetics. Knowing exactly how much of a drug is needed, how it is administered, and how long it stays in the circulatory system before being eliminated is essential in addressing and maintaining the health of our furry friends. The amount of time that drugs remain in an animal's system can be influenced by many factors, including the drug's chemical properties, the animal's metabolism, age, weight, health status, and even genetics. Similarly, certain ways of administration, such as intravenous shots or oral pills, can affect how quickly the drug is absorbed and eliminated. Veterinarians can make up for this variability by using differential equations to model the rate at which drugs enter and leave out of the body. These equations form the mathematical basis for predicting how long a drug will stay in the system and when the next dose should be given. By understanding pharmacokinetics, veterinarians can make better, more informed decisions when it comes to dosing, ensuring that the drug remains in the animal's system for the right amount of time and at the right concentration. This is essential not only for maximizing the therapeutic effects of medications, but also for avoiding toxicity. After all, a drug's effectiveness depends not just on how much is given, but on how it is managed within the body. Too little might not treat the condition, and too much could lead to serious side effects. In veterinary medicine, this knowledge helps us fine-tune treatments for a wide variety of animals, from pets like dogs and cats to livestock and exotic animals. Each species has its own set of metabolic processes, and the dosage for one species might not work for another. For instance, a drug that is safe and effective for a dog might not have the same effect on a cat, and a medication designed for large animals might be dangerous if it is given to a small pet. Understanding the principles of pharmacokinetics helps ensure that each animal receives the right dose at the right time to achieve the best possible health outcomes. So as you can see, the pharmacokinetics isn't just about knowing how a drug moves through the body. It's about using that knowledge to tailor treatments to individual animals and their specific needs. And this is where calculus becomes a vital tool in veterinary medicine. By using mathematical models and equations, veterinarians can predict drug behavior in the body, optimize dosing regimes, and ensure that animals are receiving the most effective care possible. To begin, the single-dose model describes how a drug behaves in the body after one dose is administered. After a drug is given, its concentration in the bloodstream rises as it is absorbed and distributed throughout the body. Over time, the concentration decreases and the drug is metabolized and eliminated. This method of drug administration is present for many different medical reasons. However, one of the most common is for vaccines and preventative medications for fleas and ticks. Animals will usually receive one shot, then they are not due for a booster for 1 to 3 years. The bioavailability of the drug in the system is prolonged so that regular shots are not necessary. We can visualize this model as sand in an hourglass. In this case, the hourglass can be seen as the body of the animal, and the sand level is the drug concentration. After immediately turning the hourglass to one side, the sand is at full level on one side of the glass, just like the concentration of the drug would be at its highest in the body upon first dosage. Then, as the sand slowly trickles to the other side, the sand level on the upper part of the glass goes down, just like how the drug concentration would after time. Eventually, all the drug will leave the body, and thus the concentration is zero. The differential equation used to describe the rate of change in drug concentration is the first-order equation shown here, where C of t is the drug concentration at time t, and K is the elimination rate constant. This equation can be solved to account for the initial concentration of the drug at time equal to 0, written as C of 0. C of t is the drug concentration at time t, and K is still the elimination rate constant. This model shows the consistent exponential decay of the drug in the system. Here is a graph that illustrates the single-dose model. Again, there is a spike in the concentration of the drug in the body upon first administration. Then, as time goes on, the drug slowly leaves the body until there is none left. This model, although very important in the fundamental concepts of pharmacokinetics, is not the most common in veterinary medicine. In more cases than not, the patient will need more than one dose, and thus a constant rate of drug concentration in the body for extended periods of time to maintain the drug's effects. Which leads us to the next model, the steady-state concentration model. As the name suggests, the steady-state concentration model represents at which the rate of drug administration equals the rate of drug elimination, resulting in a consistent and stable concentration of the drug in the bloodstream. A good visual example of this model can be represented with a leaking bucket. As the bucket fills, the water is leaving through the hole on the side. In this case, the bucket is representative of the body, and the water coming in through the faucet is the drug administration, and the water leaving the bucket out the side is the drug elimination. Similarly, the water level inside the bucket is representative of the drug concentration level. If this bucket were to keep filling at a consistent rate, then eventually the rate of administration through the faucet is equal to the rate of elimination through the hole, just like that of the steady-state concentration. Achieving this steady-state concentration is especially important for drugs used to treat chronic conditions, or those that require long-term therapeutic levels. Being able to calculate the maintenance dose needed to maintain a safe yet effective amount of drug in the body is extremely important for veterinary medicine. The first mathematical expression for this model is the limit of the sums of different drug concentrations from multiple doses. By finding the limit of these values, veterinarians can find the steady-state concentration to stay within an optimal range. The limit of the expression is shown here. And as before, C of 0 is the initial concentration of drug in the bloodstream, K is the elimination rate constant, and T is actually the dosing interval in this case. This equation allows vets to find the concentration at which the amount of drug eliminated between doses is equal to the amount administered. That is, the concentration fluctuates but remains consistent over time, meaning that the rate of increase and decrease are balanced. The graph shown here helps illustrate the concepts just mentioned. Here we can see how the concentration fluctuates and yet stays in the optimal range, also known as the therapeutic range. The concentration never goes above a certain concentration, or else it can be harmful to the animal, and it will never go below the effectiveness level once it gets to that point. Here we find the sweet spot of the drug in the body where we want to keep the concentration so it is at a steady state. Another important part of the steady-state concentration model is the dosing interval, which is the time in between doses that is represented by the Greek letter tau. The equation is given here, where CH and CL represents the highest and lowest concentration of the drug needed in the body in order to still be effective and not dangerous to the animal. If we look back at this graph, we can see that the space in between the peaks of the concentration is the dosing interval. Another important element that affects the steady-state model is the half-life of a drug, which is the time it takes for the drug's plasma concentration to decrease by half. The half-life of a drug affects the dosing interval because the animal might have to take the drug more or less frequently. Drugs with a short half-life are eliminated more quickly, and their concentration will decrease faster after each dose. To maintain a therapeutic level, more frequent dosing is required. And on the other hand, drugs with a longer half-life remain in the body longer, and as a result, they can maintain therapeutic concentrations over a longer period of time, allowing for less frequent dosing. In conclusion, the single-dose model focuses on how the drug's concentration changes in the body over time, influenced by the elimination rate constant, and how much drug is taken initially. This model helps us understand how quickly a drug is cleared from the body after a single administration and the initial concentration patterns. The steady-state model applies when drugs are administered repeatedly, helping us maintain a consistent therapeutic concentration over time. Achieving steady state is critical for chronic treatments, where the drug must stay within the therapeutic window to be effective but not toxic. Key factors in this model include the dosing interval, the half-life, and the elimination rate constant. By using calculus, we can calculate steady-state concentration and adjust dosing intervals to avoid fluctuations outside of the therapeutic range. In both of these models, calculus plays a critical role in predicting and managing drug levels, allowing veterinarians to dose animals accurately and ensure the desired medical effects are achieved. Proper understanding of drug elimination, accumulation, and half-life allows for safe and effective treatment, minimizing the risk of toxicity while maximizing therapeutic benefits. Thanks for listening.